Hi there, I'm Dr. Matthew Schulman, board certified plastic surgeon, and let's talk about breast reduction. The first place to start is to describe what a breast reduction is. It should become very obvious to you that a breast reduction is a surgical procedure to reduce the size of your breast. We're going to make your breast smaller. So that's the obvious part. The other part of a breast reduction, which is really important, is that we're gonna make the breasts look better. So we're gonna lift them. So a breast lift is a key component of a breast reduction. So during this surgery, we're gonna make your breast smaller, put you into a smaller cup size, as small as you wanna go, and we're also gonna make you lifted so that your breasts look more perky and more youthful. So who is a candidate for a breast reduction? Again, the answer should be obvious. It's anyone whose breasts are too big for them. So if you feel like your breasts are too heavy and they're hanging really low because of the weight of your breast, or you feel like the weight of your breast is causing you problems, causing you pain, such as neck pain or back pain, or those grooves that you get from your bra. Sometimes women with large breasts complain of rashes and irritation underneath the breast in the fold. So these are all reasons why you may want to make your breasts smaller and get a breast reduction. The surgery is performed in our fully certified, accredited office operating room, which you see behind me. It's done under general anesthesia, so you're completely asleep. During the surgery, you are monitored from start to finish by a board-certified anesthesiologist who does not leave your side. After the surgery, which can last anywhere from 2 to 3 hours, depending on the size of the reduction that we're performing, you'll go into my recovery room. In the recovery room, you'll spend probably about an hour or 2 hours until you feel okay, and then you get to go home. So this is done as an outpatient surgery, so it's ambulatory. You're able to go home the very same day. Let's talk about the scars. So the scars from your breast reduction will really depend on the type of breast reduction that we need to do. There's a bunch of different techniques that are available, and it really will depend on your body, your shape, what your breasts are like, what you want your breasts to be like afterwards. So this is a discussion that you're going to have with your board certified plastic surgeon before. The scars can be anything from what we call a lollipop, where the scar goes around the areola and down the front, or an anchor, where the scar goes around the areola, down the front, and then underneath, like the shape of an anchor. Sometimes, in very rare situations, I can even do essentially a scarless breast reduction, where I can use liposuction just to remove the breast tissue and make you smaller. This is a good procedure in someone who wants their breasts smaller but doesn't really care too much about what they look like, or someone who's older, may have some medical problems where they're not safe to undergo a longer or extensive procedure. So we can do a breast reduction by liposuction only. It's not ideal because it's not going to give you the perkiness and the lift that we talked about at the beginning, but it might be a good option for some people. If we're able to do that operation, all you would have is a couple little tiny dots hidden in the breast fold just from the liposuction. In terms of the recovery, you might be surprised to hear that a breast reduction is one of the best tolerated plastic surgery procedures that we do, meaning it doesn't hurt that much. Breast skin, breast tissue, fat doesn't really hurt that much when you cut it. What hurts is muscles, but we're not really dealing with any muscles during a breast reduction surgery. So you will have very little pain after the surgery. A lot of my patients do fine with just non-narcotic medicines like Tylenol or Motrin. You can be back to normal activities within a week and back to heavier activities in about 2 or 3 weeks. So the recovery is significantly faster than other plastic surgery procedures that you may have heard about. What's also important to point out is that breast reduction surgery is one of the surgeries that has the highest satisfaction rate, meaning immediately after the surgery or the next day, you're going to feel some relief from the weight of your breasts that are now smaller. So if you were complaining of back pain and shoulder pain and neck pain, those will go away almost instantly. So patients are really, really happy after this operation, and they don't seem to mind the scars. Some people want to know, will their insurance cover the cost of a breast reduction surgery? If you're starting out with very large breasts and you have documented medical problems because of the size of your breast, then your insurance company may consider it a medically necessary procedure. If that's the case, then they may contribute some or all of the fee for your breast reduction surgery. This is something you have to check with your insurance company specifically, because every insurance company has different requirements, different benefits, and you may or may not be eligible for those. You also want to check with your surgeon, because not all surgeons will participate with insurance. So these are the things you want to figure out before, if you're considering trying to get your insurance to pay for your breast reduction. I hope that explains a lot of things about breast reductions. It's a great operation if it's what you need. The satisfaction rate is really high, and you end up with smaller, perkier, more youthful breasts. If you want to get some more information about breast reduction surgery or set up your consultation, you know where to contact me.